Welcome to the pre-recorded information session for the Certificate 4 in Allied Health Assistance course at Mayfield Education. I'm Jonathan Ebersberger, the course coordinator, who will be running you through the information session today. To begin with, let's look at some of the points that we'll talk about as part of this information session. Firstly, we'll discuss a little bit about Mayfield Education, its history and some of the other courses that are run, and then we'll focus in specifically with information relating to the Allied Health Assistance course. Mayfield Education is one of Victoria's leading education centres that has been around for 50 years. In addition to the Allied Health Assistance course, there are a number of other health courses that are run, such as nursing, diabetes education, and sterilisation services, just to name a few. Mayfield Education is a not-for-profit organisation, and with all of our training and assessment, we try to specifically cater for the individual needs of each student. You'll be given support throughout your time here at Mayfield Education, and all the training and assessment conducted is developed in accordance with the standards and regulations that are required. Could you please look at some of these special considerations and see if any of them may apply to you? We have three areas. Firstly, learning challenges, then pre-existing injuries, and also lastly, any job commitments or requirements. Could you please read through these three, and if you feel like you have any special considerations in those areas, could you please make a note of it, and then we can have a chat about it in our one-on-one meeting a little bit later on. Something important to keep in mind is, as part of a course prerequisite requirement for the Allied Health Assistance course, you're required to have a police check and working with children's check, which can both information for those can be obtained either from student services or online. In addition to those two checks as well, you'll need a vaccination or immunisation status check, which can be attained from your local doctor. These requirements are specifically needed as part of clinical placement, as all health host agencies require that you have these forms completed well in advance to undertaking clinical placement. If you would like any further information about what your rights and responsibilities are as a student, then please visit the Mayfield Education website to find the Student Information Handbook. Depending on other previous courses or qualifications that you've undertaken, you may be eligible for either credit transfer or recognition of prior learning. If you think you may be eligible for these, could you contact Student Services and they can direct you through the process. As part of the course in Allied Health Assistance, you can either undertake the course by paying full fees or as being funded through Skills Victoria. Once again, please contact Student Services for any questions relating to this. The delivery styles of the Allied Health Assistance course here at Mayfield Education are that there are face-to-face class days, which primarily includes lectures and practical group activities. We normally don't try to have too much PowerPoint lectures. We normally aim for about 15 minutes of PowerPoint without any practical or group discussion. So rest assured it will be very practical and you won't be sitting there for hours on end listening to just lectures from PowerPoints. In addition to the face-to-face classes, we also have self-directed learning done at home. That may either be through workbooks and assessments or other online learning and study, such as preparing for the classes or reviewing the content after classes. Additionally, we try to aim to have a few excursions as part of the course as well, so that you can break it up a little bit from the face-to-face classes. The excursions that we have planned are always conducted on the same day as the face-to-face classes, so you won't need to allocate any extra time outside of those dates. The last part of the delivery of the course is clinical placement, which we'll talk about a little bit later in one of the other slides. The intakes that are usually offered each year is a February intake and a September intake, meaning there will be 2 intakes running each year. If you would like my contact details, then this email address here would be the best one to directly contact me, because as I work part-time at Mayfield Education, I may not always be able to get back to you via phone. I currently work part-time at Mayfield Education every Thursday, Friday, and every second Tuesday. In addition to the work I do at Mayfield Education, I also work in clinical practice as a clinical myotherapist. If you have any additional questions that is more relevant to student services, then please note the phone number that's listed there. As part of the course and some of the entry requirements, we have entry criteria that you have an ability to be able to accurately read, write, and communicate in English. Also, it's required that you have a mobile phone so that you can be contacted about anything with regards to the course, and access to a computer at home, because a lot of the assessments are conducted online through our online learning platform. As was previously discussed, with this course we're using the blended learning format, which involves in-class activities, work at home, and also work placement as well. Now, an interesting question that a lot of students ask: how much study is required? Well, as the face-to-face classes are run only a couple of days, then obviously a little bit of work will be required at home as well. This work may be some of the assessments which are conducted online, or it may be preparing for classes or reviewing content after the classes. So we'd normally suggest that you can try to work out your schedule in advance by thinking about other commitments you may have, such as work, family, or social commitment, and putting them in a calendar, and then seeing how you can fit in regular study each week. If you don't do any study or work at home, then it will be very difficult to be able to pass the units and move forward to complete the course. As part of the overall course in Allied Health Assistance, the minimum attendance requirement for the class days is 80% overall attendance requirement. The class days will be Thursdays and Fridays from 9 a.m. to 4 p.m. every fortnight. So every 2 weeks there'll be classes on one of the Thursdays and Fridays, which will be in the same week. So overall with that, an 80% minimum attendance requirement. And we also have, as part of the in-class days, some assessments that are conducted in class. You must be able to complete those assessments in class, and there is a 100% completion requirement for those. So please make sure in advance that you know when the in-class assessments are, so that you don't miss them. Talking a little bit further about assessments, we have a wide variety of assessments that we use as part of this course, so that you can be assessed with a variety of different formats. The main assessments that we have, talking theoretically, are examinations, assignments, presentations, self-directed work, and electronic learning. For all of those assessments, you will gain a result that is either competent or not yet competent, where resubmission may be required. For all of the assessments, you'll be able to have 2 attempts at getting a competent result. And if you are not competent on the first attempt, you'll get very detailed feedback that will be able to guide you in how to complete the assessment for your next attempt. As discussed before, make sure that you prepare in advance to study and use whatever method you find best to organize yourself so that you allocate specific time for classes and study at home. Now talking specifically more about allied health professionals, these are the main professionals who you will encounter in the allied health field. There may be others, but we have picked the top 4 professionals: physiotherapy, occupational therapy, speech pathology, and podiatry as our specialist units for the Allied Health Assistance course at Mayfield Education. What do you think working as an allied health assistant may involve? Well, one of the most common definitions used to describe this is an allied health assistant is someone who provides therapeutic and program-related activities under the guidance of an allied health professional. Let's explore this now in a little bit more detail. When you are working as an allied health assistant, there may be a variety of tasks and activities that you will be involved in. Firstly, there will be client-related tasks, which may either be in group work or one-on-one. So that could be specifically prescribing exercises. There are also non-client related activities, such as work relating to equipment, administration, organizational tasks, and infection control. Now to talk a little bit further about clinical work placement. The placement requirements as part of the Allied Health Assistance course is to have 120 hours of clinical experience. We usually organise this over a 15-day period in a 3-week block with normal working hours. And all of the clinical placement is organised on your behalf through Mayfield Education. So you won't have to do any of the heavy legwork trying to organise placement. It will all be done for you, and you'll be provided with specific details further at the time, well in advance of when placement begins. We also try to cater placement around where you live. So for example, if you live in a rural area, we wouldn't expect you to travel to the city every day to be able to complete placement. As part of clinical work placement, we have a 100% attendance requirement that is logged and checked off in your clinical placement workbook. We also have a placement uniform and some requirements relating to that. We have a Mayfield Education polo shirt or long sleeve shirt that can be attained when you begin undertaking the course, and also requirements for dark pants and dark shoes with minimum jewellery as expected in most of the allied health fields. Now to conclude the information session, the next phase of your session today will be the literacy and numeracy assessment. This will be conducted in a number of parts. Parts A to Part D are all conducted online using the online test. And then after that, there will also be a computer skills test that checks that you have a basic understanding of Microsoft Word, Microsoft Excel, and also the internet. Once those tests are conducted and completed, there'll also be a one-on-one interview with myself for any further questioning or that you may have, and also to run through some more specific detail relating to the course. So that now concludes the pre-recorded information session for the Allied Health Assistance course.